Welcome to Everyday Nursing Knowledge Lectures, and today we will learn how to calculate medication dosage or medication dosage calculation. So to calculate medication dosage, you should be familiar with different units of measurement and the formula for the medication dosage. So different units of measurement are 1 teaspoon is equal to 5 milliliters, 1 tablespoon is equal to 15 milliliters, 1 ounce is 30 milliliter, 1 cubic centimeter is 1 milliliter, 1 liter is 1000 milliliters, 1 kilogram is 1000 gram, 1 gram is 1000 milligram, 1 milligram is 1000 microgram. So it goes by 1000, by kilogram, gram, milligram and microgram. So you should be able to convert these different units of measurement. And finally the weight, 1 kilogram is 2.2 pounds. The weight-based medicine are calculated in kilograms. So in case if there is a question that gives a patient weight in pounds, you should be able to convert pounds to kilogram. So you should be familiar, or you should memorize these different units of measurement. Now the formula to calculate your medicine dose is dose ordered divided by dose available into quantity. This quantity can be in ml if it is in liquid, or tablet or capsule. Again, dose ordered and dose available should be in same unit. If dose ordered is in milligram, dose available also should be in milligram. If dose ordered is in microgram, dose available should be also in microgram. Now let's see the first question. A patient is ordered to take Maalox 30 ml PO, that is by mouth. How will you instruct the patient to take the medicine in tablespoon? So the ordered dose is 30 ml and you have to convert this in tablespoon. You don't have to use the formula. Instead, you should be familiar how much is milliliter and tablespoon. So, you know from previous units of measurement, 1 tablespoon is 15 ml. Now you have to convert the milliliter into tablespoon. So 1 milliliter is equal to, this goes down 1 by 15, 1 divided by 15 tablespoon. So if 1 milliliter is 1 by 15 tablespoon, how much is 30 milliliter? 1 by 15 into 30, that gives 2 tablespoons. So you will instruct the patient to take 2 tablespoons of medicine. Now let's see the second question. A patient takes warfarin 5 milligram at home. After checking INR, doctor adjusts the dose to 7.5 milligram. How many tablets should patient take? So doctor ordered 7.5 milligram. So the dose ordered is 7.5 milligram. Dose available is 5 milligram per tablet. So you have the formula. Dose ordered is 7.5. Dose available is 5 milligram. That is in 1 tab. So now let's calculate. That is 7.5 milligram divided by 5 milligram into 1 tab. You can cross milligram, 7.5 divided by 5, that gives 1.5 tablets. So you have to give patient 1.5 or 1.5 tablet. Now the next question. Doctor ordered Xanax 0.5 milligram by mouth. So this is the ordered dose. Ordered dose is 0.5 milligram. Dose on hand, that means dose available is 0.25 milligram Xanax. That means 0.25 milligram in 1 tablet. How many tablets will you give? So its dose ordered is 0.5. Dose available is 0.25 milligram. Again, the ordered and available is in same units. Into 1 tablet. That gives 2 tablets. Next question. You need to administer 250 milligram of erythromycin by mouth. You have 0.5 gram tablets. How many tablets will you give? So 250 milligram you need to administer. So that's the order dose. You have 0.5 gram tablets. That means the dose available is 0.5 gram tablet in 1 tab. So here you can see the dose ordered and dose available is in different units. So you have to convert. Let's convert this gram into milligram. So from the units of measurement, you know 1 gram is 1000 milligram. So 1 gram is 1000 milligram. So 0.5 gram is 1000 into 0.5, that is 500 milligrams. So the dose available is 500 milligrams. So now let's calculate 250 dose ordered divided by dose available is 500 milligram. These two are in same units of measurement. Now in one tab, that gives half tablet. So the answer is, you will give the patient half or 0.5 tab. Now the next question. A patient is instructed to take digoxin 0.25 milligram PO. You have digoxin 0.125 milligram on hand. So the dose ordered is 0.25. Dose available is 0.125. How many tablets should you give? So to calculate dose ordered 0.25 divided by dose available 0.125 into, that's in one tablet, into one tab. So when you calculate milligram, you will cross 0.25 divided by 0.125. That gives you 2 tablets. So you will give patient 2 tablets. Sixth question. A patient is ordered codeine 45 milligram IM. So 45 milligram is dose ordered. You have codeine 60 milligram per 2 ml. So that's the dose available. That is 60 milligram and the quantity is 2 ml. So how many ml should you give? So to calculate 45 dose ordered divided by dose available 60, it's in same unit, into quantity, it's in 2 ml. So 45 divided by 60 into 2, that gives 1.5 milliliters. Next one, you have an order to administer 40 milligram of methadone for opioid detoxification. You have on hand 30 milligram per ml. So 40 milligram is the dose ordered and 30 milligram dose available and the quantity is 1 ml. How much should you draw on syringe? So 40 divided by 30 into quantity number 1. So 40 divided by 30, that gives 1.3 ml. So the answer is 1.3. Order to administer 0.5 milligram by mouth daily. So you have an order to give 0.5 milligram dose order. You are dispensed with 100 microgram per tablet. So this is dose available, 100 microgram in one tablet. How many tablets will you give? So you have all the values, but you can see dose ordered and dose available is not in same unit. So you have to convert this microgram into milligram. So to convert, 1 milligram is equal to 1000 microgram. You are planning, you have to convert the microgram into milligram. So 1 microgram is 1000 goes down 1 by 1000 milligram. So 100 microgram is 1 by 1000 into 100. That is 0.1 milligram. So you have the dose available 0.1 milligram. So let's calculate now. Dose ordered is 0.5. Dose available is 0.1. Same units into quantity. So 0.5 divided by 0.1. That gives 5 tablets. So you'll give the patient 5 tablets. Next question. Ordered medication dose is 200 milligram. You have an ampule of 500 milligram in 4 ml. How much will you administer? So the ordered dose is 200 milligram. Available is 500 milligram and quantity is 4. To calculate 200 divided by 500 into quantity number 4. That gives 1.6 ml. 10th question. Ordered medication dose is 1 milligram IV. So 1 milligram is dose ordered. You have a vial with 0.4 milligram per ml. That's the available dose, 0.4 milligram, and the quantity is 1 ml. How many ml will you draw up to syringe? So to calculate, let's put 1 milligram divided by 0.4 milligram into quantity number 1 ml. That gives 2.5 ml. Next question. You have diluted 4 mg per ml. So that is the available dose, 4 mg. The quantity is 1 ml. You need to administer, that means the ordered dose is 0.015 mg per kg. So when you see a ordered dose of milligram or microgram per kg, that means it's a weight-based medicine. That means the dose can vary with the patient weight. So you have to calculate the patient's correct dose. To a patient who weighs 150 pounds, So 0.015 milligram per kg means 1 kg can get 0.015 milligram. So how much a patient of 150 pounds can get? Again, in medication dosage calculation, it's done in kilogram. So you have to convert 150 pounds to kilogram. So from the units of measurement, you know 1 kilogram is 2.2 pounds. So you have to convert pounds to kilogram. So 1 pound is 2 by 2 goes down. 1 by 2 by 2 kilogram. So 150 pound is 1 divided by 2.2 into 150. That gives 68.18 kilogram. So always remember, if you get a question with a patient who weighs in pound, when you have to convert it to kilogram, make sure you divide it by 2.2 and you will get the value. So the patient weight is 68.18. Now you have to find the dose ordered. The dose ordered is for 1 kilogram, it's 0.015. So a patient who weighs 68.18 is 0.015 into 68.18. That gives 1.02 milligram. So the patient can get, or patient is ordered 1.02 milligram. So now to calculate how much ml will you administer, the dose ordered is 1.02, dose available is 4 and quantity is 1 ml. If you put it in this formula, you will get 0.26 ml. So you will give 0.26 ml of medicine. Next question. Doctor orders an IV weight-based medication to be infused at 2 microgram per kg per minute. Patient weighs 130 pounds. Again, the order dose is 2 microgram per kg per minute. Again, this is a weight-based medicine. The patient weight is 130 pounds. You are supplied with a bag of IV medication that reads 250 milligram and 250 ml. So that's the dose available, 250 milligram, and quantity is 250 ml. How many ml per hour will you administer? So you need the answer in ml per hour. So first you have to convert the weight, the pounds, in kilogram, because in medication dosage calculation, if it's a weight-based medication, you should use, the weight should be in kilogram. So to convert the 130 pounds to kilogram, you have to divide by 2.2. For that, it's because 1 kilogram is 2.2 pounds. So 1 pound is 1 divided by 2.2 kilogram. So 130 pound is 1 divided by 2.2 into 130. Or always remember, to convert pounds to kilogram, you divide by 2.2. So that gives you 59.09 kilogram. Now the order dose is 2 microgram per kg per minute. That means 1 kg can have 2 microgram. So 59.09 can have 2 into 59.09. That gives 118.18 microgram per minute. So the dose ordered is 118.8 microgram per minute. But look at the question. The dose available is in milligram and dose ordered is in microgram. So you have to convert this microgram into milligram. So to convert microgram into milligram, you have to divide by 1000. It's because 1 milligram is 1000 microgram. 1 microgram, 1 by 1000 milligram. So 118.18 microgram divided by 1000. That gives 0.12 milligram. So the dose ordered is 0.12 milligram per minute. So you have milligram and ml. So the dose ordered is 0.12 milligram per minute. Again, the question asks for ml per hour. So you have to convert the minute into hour. To convert minute into hour, you have to divide it by 60. So 0.12 milligram, 1 minute is 1 by 60. So 1 by 60. So 0.12 into 60, that gives 7.2 milligram per hour. So the dose ordered is 7.2 milligram per hour. Now you have the hour. Dose available is 250 milligram, quantity in 250. So to calculate, 7.2 milligram per hour divided by 250 milligram into 250 ml. So milligram will cross. 250, that gives 750 ml divided by hour. So the answer is 7.2 ml per hour. Next question. An order to start heparin drip at 5 units per kg per hour. So that's the order dose. Again, it's a weight-based medicine. And to administer a bolus of 10 units per kg. So before starting the drip, you have to give the bolus. You are supplied with heparin bag that reads 12,500 units per 250 ml. So the dose available is 12,500 units and quantity is 250 ml. Patient weighs 110 pounds. So you have to find the dose ordered for this patient. What is the flow rate? You will set the IV pump rate. So let's calculate the weight now. So 110 pounds, to convert it to kilogram, you divide by 2.2, that gives 50 kilogram. Now you have to find the ordered dose. Again, there are two ordered: to give heparin drip at 5 units per kg per hour and to give a bolus of 10 units per kg. But in this question is asking for flow rate. If the question was how much loading bolus will you give, then the ordered dose will be 10 units per kg. But the question is what is the flow rate, what you will set in the pump. So the ordered dose is 5 units per kg per hour. So remember, this is a distraction factor. This can be a distraction factor. So for patient who weighs 50 kilogram, what is the ordered dose? So 1 kilogram, patient should get 5 units. So a patient who weighs 50 kilogram, 5 into 50, that patient should get to 50 units per hour. So you have the dose ordered to 50 units per hour, dose available. So let's now calculate. 250 divided by 12,500 units will cross. 250 into 250 ml divided by 12,500 hour, that gives 5 ml per hour. So the answer is 5. Next question. Doctor ordered an IV drug for a child who weighs 78 pounds. Safe dosage range for the ordered medication is 5 to 10 microgram per kg per minute. What is the safe dosage range for this child? Again, this is a weight-based medicine. Let's convert the pound into kilogram. To convert, 78 divided by 2.2. So the child weighs 35.45 kilogram. Now the ordered dose is 5 to 10 microgram per kg per minute. That means 1 kilogram can get 5 or 10. So 35.5 kilogram means, so 5 into 35.45 gives 177. 35.45 into 10, that gives 355. So the safe dosage range is 177 to 355 microgram per minute. Now our last question. Doctor orders a 10 milligram of medication by mouth. So this is the dose ordered, 10 milligram. That needs to be reconstituted. That means that needs to be diluted. Instruction on the 0.25 container, gram container. So this is the total dose available. To reconstitute with water. So you're diluting the powder with water and to make a concentration. So the concentration will change to 0.5 gram per 3 ml. So the dose available is changed to 0.5 gram and the quantity is 3 ml. So again, this can be a distraction factor. So dose ordered is 10 milligram. Dose available is 0.5 gram, quantity in 3 ml. So if you look at the dose, it's in 10 milligram, 0.5 gram. So you have to convert gram into milligram. So to convert, again, 1 gram is 1000 milligram, 0.5 gram is 500 milligram. Now you have everything in same units. So now calculate. 10 milligram order dose, 500 is dose available into quantity in ml, 3 ml. That gives 0.006 ml. So today we learned about medication dosage calculation, and thanks for watching my video.